Hello everyone. Thank you so much for joining in. This is Ashwini from Inspire IMG. So, Inspire IMG is a social networking platform connecting doctors across the world. This platform is for you to help young doctors, medical graduates exploring international career options, and to help international medical graduates in their career progression. Now, we recently had doctors from US, UK, Australia talking about various topics relevant to international medical graduates. So we do have many such similar events coming up for you. We have doctors from Canada, Australia, UK coming up after this session and sharing various updates in regard to career pathway for IMG in these particular countries. So join Inspire IMG to be updated on all the future events that's coming up for you. And also please follow us on Instagram. Our Instagram handle is @InspireIMG to participate in poll questions, surveys, and so on. So today we are here to discuss on clinical radiology as a career in the UK for international medical graduates. And also we're going to discuss about career progression for IMGs in the UK. So I have the honor of introducing our speaker for today, Dr. Venkat Ramana S, Consultant Radiologist and CEO of Excell Hospital, Hyderabad, and the first ever ambassador for the UK Royal College of Radiologists and Oncologists. I'm sure and I know all of you are eagerly waiting and looking forward to the session today. But before we start, please help us to understand you a bit more better. You will see a couple of poll questions coming up now. Request you to please choose the relevant answer. We would like to know in which year of medical school are you. This will help us to understand how young the audience is today. Request you to please select the relevant answer. Great. So I think larger percentage of doctors attending session today have completed medical school and internship. Nice. Also, you have another poll question coming up.
Ashwini, sorry to interrupt. In that question, I would also like to know how many have been doing post-graduation or done post-graduation.
Okay. Ijaz, is there an option to add it right now?
I'm checking.
Okay, before the technical...
Possible, Ashwini. I just put it up in 2 minutes.
Sure.
Meanwhile, I'll put up the other poll question.
Sure. So before that question gets ready, now doctors attend a session today. I want to know how many of you have this. Okay, my target branch is radiology. You've decided it is radiology for you. And who are still not clear about if it's radio or not radio for you. If you can just answer this question. Are you sure about the target specialty that you're choosing? Okay. I think the larger percentage is sure that it is radio. Yes, we have 37% of doctors who are unclear still. Is it radio or any other clinical specialty that they're exploring about? Thank you. Now, most of you, yes, have said that it is radio for you. So I want to know, you are here today, you're exploring radiology as a career in India, UK, US, Australia, or any other country. If you can just give me your first preference. Which of the following countries do you wish to pursue your radiology in? Okay, very nice. So we have larger percentage of doctors attending session today are here who are saying that it is UK. Thank you. So, one last question for all of you now. What is a major challenge in your journey? Now, most of you are here today. I think you all are exploring international career options. What is a major challenge that you have? Is it that you do not have right connections, or not having a good mentor to help you in the journey, or passing the entrance exams itself is quite challenging for you, or uncertainty in matching to a particular specialty is quite challenging? You can see your options on the screen. Okay, great, nice. So 62% of doctors saying that a lack of mentor or having the right connections to guide you in this journey. So thank you so much for your time. Ijaz, do we have that question? You can see the poll question on your screen. What's your medical post-graduation status? Do we have anyone in the audience today who's pursuing post-graduation or who's completed post-graduation? Request you to please give the relevant answer.
Sorry, I think the third option should be I'm not a postgraduate.
I think that we had in the previous one, doctor.
Okay.
How many of you are doing MBBS? So I think most of them had completed MBBS and internship. Okay, this is quite surprising. So 81% of doctors attending session today are in their PG.
But this is attempted only by 21 students.
Correct.
So
I think
the rest are not postgraduates.
yes, the rest are not postgraduates. They're MBBS doctors, like what we saw in the previous poll. And we have 4 of them, ideally, out of 21 who've completed post-graduation.
Interesting.
Yeah, so thank you so much to all of you for attending session today, and a very warm welcome to Dr. Venkat. I mean, he has the busiest schedule, and as soon as we asked, he did take some time and he said, yes, I can be there if it's going to help IMGs. Thank you so much, doctor, and over to you now.
Thank you. Thank you, Ashwini. And I sincerely thank Inspire IMG, Ashwini, Ejaz, and all the colleagues for inviting me and also arranging this session. And I'm very impressed that I can see 67 participants, which is quite impressive, and just comes to know that how many students are really serious about their career, especially working or studying abroad. So great to be here. Thank you.
Thank you, doctor. We ideally had 500 plus registrations. Unfortunately, being Monday, the first working day, they all are held up with work. We are getting many calls who are asking, can we get the recording? So we will be sharing the recording with doctors who've registered with this. So doctor, as you saw, I mean, the poll answers here, many of them who are here today are more keen to know about the UK segment. So if I have to just start it, I mean, what's the structure or training pathway for clinical radiology program in the UK, doctor? If you just want to brief the audience today on what is the pathway to become a radiologist in the UK.
Okay, so just going back a bit, let me just give my background to all the audience so that they also know, and that will help them to make a decision regarding their own questions when we move on to the interactive discussions later on. So I went to the UK in early 2000. So it's been more than 2 decades since I've gone there. And then I was a pediatrician before entering radiology. I just finished my MRC PCH and then started applying for radiology jobs because that is what I was keen to do. And I wanted to do something related to pediatrics and radiology. So eventually ended up as a pediatric radiologist. But also I do general stuff and mostly emergency radiology, which includes pediatrics as well. And then I was a consultant for many years in the NHS. Then my last couple of jobs were in Birmingham City Hospital, which is a major trauma center, one of the top centers in the world. And currently I'm the clinical director for a largest teleradiology company in the world called Medica. So we do radiology from UK, US, Ireland, Australia. So that is a bit of about background. So I moved quite a bit from India to UK and other countries because my doctors are spread out all over the world. We have about 500 doctors, most of them in the UK, but also many others in Asia, Australia, and USA. In fact, I just returned yesterday from a conference in Dubai, and I was in UK just before that. So why I'm saying all this is that I probably know quite a lot about the radiology field, but not just radiology, but also careers in general, because I generally see so many people coming across, and being a radiologist, you are basically in touch with many clinicians, which is probably the best part about radiology, because you are basically a physician who knows head to toe about everything. And every sick patient has to go through radiology. So that's probably the best part about this. So I'm opening this so that I give a broad overview to all of you. And I probably would not advise you to have just one option, which is clinical radiology, which is the toughest field, and it has always been the toughest field to enter since a very long time. Of course, in India, in no matter which country you go, it's been the top number one or number two fields of preference. And the number of seats also quite significantly less than other specialties. So it's probably a very niche specialty for anybody to be in. And I know people who have struggled quite a bit to enter radiology, but I would always have second, third options as well. Because nowadays there's a very close links with radiology and other clinical specialties. And for example, I'll tell you, vascular surgery. Vascular surgery has almost overlapped with interventional radiology. So a lot of us do a bit of both. And also the training is also covered under vascular surgeons as well as radiology. So there has been quite a bit of overlap between the two. Neurology, for example, there's a lot of neurologists who see their own scans and they interpret their own images and they start their own treatment based on their own interpretation. And some are very good. Of course, they do need a report for formality, or there are some tough cases, or that there are some rare cases, etc. But as an example, I'm just telling you that there's quite a lot of overlap, which may help you take a decision. If not radiology, then what are the other options? Okay. So regarding radiology itself in the UK, usually the preference has always been some clinical experience. So 2 years ideally of clinical experience in any other medical fields like general medicine, general surgery, etc. After which you have probably a better chance about entering into the field of radiology. So we'll come to the more specific details as we go along when Ashwini asks me some more questions.
Sure.
But over to you, Ashwini. Let's carry on. I don't want to just go through myself. I just wanted this to be interactive.
Doctor, as you said, radiology is competitive. I mean, this is what we get. As you know, Inspire IMG is powered by Go Campus, and Go Campus assists doctors for higher training in UK, US, India. I think any doctor that first meets us, when we ask, it's mostly radiology, that I'm trying for radiology. So we get to listen to this very frequently. They ask us, is radiology really possible for IMGs in the UK? Like you already said, it is very competitive. But I just want to know from you, is it like it's impossible? Or there are doctors who are attending today who have the first option as radio? Can they still try, go ahead and put across the best portfolio there? What is your advice, doctor?
Yes, there is nothing impossible in this world, as they say. But are you prepared for the competition, and can you take the stress of going through that? Because there will be 200 applicants for 10 posts. So 1:20 ratio. So what makes you stand out from the 20 applicants is what you really need to think and be realistic about. So there's no point in getting disappointed at the end of the day and say that I don't have the luck, or I'm not getting in spite of being repeatedly applying and so on. It's probably due to one or two reasons which you don't know and which you can work on. Question is, are you prepared to work on? So I'll tell you my own example. So when I went in 2000s, I did 3 years of pediatric work, which is quite tough in the UK, as you can imagine. It's nights on call. I was in pediatric intensive care. It was very tough life. And then at the same time, I had to do something on radiology so that my application is standing out from the others. So I did my MSc in medical imaging at that time, and did some papers, some posters, some audits. And as I say, there's nothing easy in the field of medicine, and especially in radiology, this stands very true. So you have to really work very hard. Of course, you have to be there at the right time in the right place. But I think if you work hard, your luck also favors you at the same time. So, but the important part is to really plan, analyze the situation, and make your application stand out from the rest of the others. If that's the case with you, then you'll have a very good chance. I won't say 100%. I can only say very good chance of getting into radiology.
So, doctor, when you say good application, I guess you're talking more about the portfolio part, right, doctor?
Yes.
So, if I have to just briefly tell them, like, how should they work on, as you said, that they have to stand out from the competition, what are the major aspects that they should focus on if they really want to stand out from the competition, and if they're really aiming at making it to radiology?
Okay. So I'll be very realistic and very straightforward here. So you are competing with British people, or if you're going to USA, you're competing with Americans. And of course, nobody is going to give to you without giving to the Americans. So essentially, we are working for the unfilled posts. Okay. And that is a reality, because anywhere you go, they want to protect their own country people, their own interests, etc. So you have to digest this fact. The second thing is, you are competing with many brilliant people from all over the world, not just India. Right? There are people from Singapore, Hong Kong, Malaysia, African nations, Egypt. There are Americans sometimes, although rare, but there are South Americans, quite a lot of them. So you can imagine how tough the competition is for those remaining posts which are open for non-British candidates, as you can say. So this is unofficial, but that's what you can think and prepare on those lines. Within the Indian applicants, the Indian cohort, there are a lot of postgraduates who have done radiology or doing radiology who are also applicants. So obviously they have much more better knowledge about radiology. They probably have part 1 FRCR as well when they are doing radiology MD in India. Again, that will give them a lot of headway regarding that. And just to come to the part 1 FRCR, you actually don't need any MD or any recognized training scheme to do your part 1 exam. So if you are a bright student who can understand the physics and learn on your own, maybe do an attachment in a big nice hospital somewhere, you can in fact do the part 1 without having MD experience. But it is very tough, as you can imagine. In general, the FRCR exams are the toughest amongst all specialities in the UK, as well as in many countries. So you are competing with essentially a lot of people who are really serious about their intentions about ending up in radiology, and that is what you have to be aware when you're preparing your CV. So it's not going to be just a few months of applicants, a few months of the process of planning and applying, but I would say it will take a few years to get to that stage where you're equally competitive with your CV, your background and exams and all these things.
Thank you, doctor. So now, what is the selection criteria to actually match to ST1 radiology, doctor? One is, you said, portfolio.
Yeah.
What will be the other factors which will contribute for the selection?
Yes, it's a good question. So coming to the selection points, every region, what we call as a training scheme or a deanery. So a deanery